ready for med ed again. So the next procedure I'd like to go over with you is how to use a bedpan and a fracture pan. So I'm going to show you both procedures, but just to kind of show the difference for now. This is a fracture pan. A fracture pan is flat. When you put this under the resident, make sure the handle goes toward the foot of the bed. This is what we call a standard bedpan or a wider bedpan. This one, you want the wider end aligned with the buttocks and this big open end toward the foot. Now for your procedure for your state test, if you get this procedure as a skill, it doesn't matter which bedpan you use, the procedure is identical. I will show you both, but for your state test, you only have to do one or the other. So I start by doing my initial steps, and I ask my nurse about my resident's needs, abilities, and limitations. She's told me that Mrs. Smith has requested the bedpan. I've knocked on the door, gotten permission to come in. I've greeted my resident by the name they prefer, identified myself by name and title, and explained what I'm going to do. I found and gathered my supplies, so I've got my equipment, I've got a towel and a washcloth, and some gloves. I'm going to provide for privacy, close the curtain drapes and doors. I'm going to wash my hands, wear gloves, provide fluids, and use good biomechanics. So when you put somebody on a bedpan, the first thing you want to do is put the bed flat. That puts them in the correct position to put the bedpan underneath them, and you don't want to turn your residents with their head up. It puts them in bad body alignment. Put your gloves on. Make sure you have your side rail up on the far side of the bed. And don't forget to check your gloves for rips, holes, and tears. Turn your resident toward the raised side rail. Now first, the fracture pan. You want the handle toward the foot of the bed, put it up against their buttocks, line it up, and push down. See how I'm pushing on the bed? Push down on the bedpan as they roll back. Roll them back towards you. And you want to check to make sure it's in the correct placement. Obviously, if it's not in the right spot, it's going to go all over the bed. Hand them the call light, hand them the tissue, and then raise the head of the bed. Now, how far up they want to go depends on your residents. Some of them just a little bit, some of them all the way up into a Fowler's position. You're going to leave them with their call light and tissue, come back when called. Now when you're taking them off the bedpan, very meticulous step by step so you don't spill this bedpan, have to make the bed, clean up the resident. First, put the bed flat. And then before you turn them, push that bedpan flat to the bed because it will suction cup up against their buttocks and spill all over. So I'm reaching under, I'm going to push the bedpan flat and then ask my resident to roll toward the raised side rail. You put the bedpan at the foot of the bed, you wipe down in the front and up in the back. You're going to wash your hands and change your gloves, bring your residents back towards you, and provide perineal care if needed. Cover your bedpan, take it to the bathroom, and you're going to check COCA, C-O-C-A. That's color, odor, characteristics, and amount. If something's wrong, so there's a foul odor, there's blood, there might be floaties, leave it for the nurse to check. If everything's okay, you're going to clean this according to facility policy. Put the towel in your bag at the foot of the bed. Put your bedpan back where you found it. Take off your gloves. Wash your hands, assist them to wash their hands, and then wash your hands as part of your final steps. So the standard bedpan is pretty much what I just showed you. So again, do all those initial steps. Make sure your residents, heads down, put gloves on. And what are you checking those gloves for? That's right. Roll them toward the raised side rail. Now the standard bedpan, again, put it up against their buttocks, kind of light it up. This part goes toward the head, the big wide part, or the open part there goes toward the feet. So the wider part goes in line with their buttocks. Up against the buttocks, push down as they roll back. Check for placement. Paw light, tissue, head up. And again, how far up is going to depend on the resident. Leave, return when called. Lower the head of the bed. Reach under the resident, push the bedpan flat to the bed before you roll them over. Well, thank you. The bedpan goes to the foot of the bed, wipe down in the front and up in the back. Wash your hands, change your gloves, bring them back towards you, and do perineal care if necessary. Cover the bedpan with a towel, take it to the bathroom, check coca, color, odor, characteristics, and amount. If something's wrong, leave it for the nurse to check, and if everything's okay, clean it to company or facility policy. Put that in your dirty linen bag, put your bedpan back where you found it, take off your gloves, wash your hands, assist them to wash their hands, wash your hands again, and then do those final steps. A, check alignment, make sure they're comfortable. B, make sure the bed's in the lowest position. C, make sure they have their call light and water. D, ask them if they need anything else before you go. And E, everybody deserves a thank you, so thank your residents. F and G, find and gather your supplies, clean them to company or facility policy. H, ask how they want those curtains, open or closed. And then I your way out. I'm gonna wash my hands, do a visual safety check, report unusual findings to my nurse, and document my procedures. Thanks for watching.